You good?
Welcome, Dr. Kelley, to the Biohacker Babes podcast. Thanks for joining us today. How are you?
I'm great. Thank you for having me.
Yeah, we're really excited. We are talking about a topic that has not been discussed on our podcast yet, which is a little bit crazy, but maybe also not, because there's not a lot of attention around this, but there should be. So we're really excited to pick your brain today about that.
Yeah, let's jump in.
Yeah, I am going to just dive right in because I think a lot of people are struggling with Lyme, and that's what we're specifically talking about today. Lyme disease, co-infections, whether you're symptomatic or not. And we're not talking about it enough. I think if you're lucky enough to be working with a doctor that has effectively addressed this, it probably wasn't your first doctor, probably have spent a lot of money trying to figure out why you're not feeling well. So yeah, we're just hoping to spread the word and keep sharing education and resources. And you're doing incredible work teaching about this and really supporting patients to get to the root cause and address the bio individual, because we know it's different for everyone. But when we really pare it down, we can support the physiology like on a really foundational level. So we are always seeking answers that conventional medicine cannot answer. And I think you are as well. So we're kind of curious, how did you even come into this? Why did Lyme become more of a specialty for you?
I think like most people who are in this field, it's either their own personal story or that of a loved one. For me, it was my personal journey. I had health issues for a long time and didn't know what was going on, assumed it was this, that, or the other. Was diagnosed with postural orthostatic tachycardia syndrome in med school, and thought that was the deal, but that was just a symptom of underlying Lyme and Bart and probably Babesia as well. And it took a long time to figure it all out. And through that journey, I got straight from med school, I went into integrative medicine. I knew there needed to be more curiosity. We needed to find out why people were sick, and just diagnosing and giving meds didn't sit well with me. So I immediately went into that field, and through that, I, learned more and more about my adrenals and what else I was doing to my system. And then just kept hearing Lyme and Bart and these names and these words. And back then and it still is to this day, but back then it was still pretty scary to dive into treating these as a physician, because physicians are losing their license treating these things. And so it was a little terrifying to kind of step into that and put my toe into that water. But as soon as I jumped in and started getting treatment for myself and started looking for it in my patients, I realized it's everywhere. And there's so much we can do to help these patients that I haven't turned back since, and just have moved forward to really try to help this population see improvement.
Well,
Thank you so much for diving in.
Yeah. I'm sure that's hard. And, we've watched our dad kind of a similar thing. As a biological dentist, he learned about the dangers of mercury in the mid 80s. And it was like, do I want to dive into this? So appreciate that you dove in. So for someone that's struggling with maybe like a chronic mystery illness, and it could be Lyme, what are some of the symptoms or health complaints that are kind of red flags for you to say, this could be Lyme in this case?
Yeah, it's difficult because especially when you get into the chronic stage, it can mimic so many other things. It really is called the great mimicker, and it can present as multiple sclerosis type symptoms, rheumatoid arthritis type symptoms, postural orthostatic tachycardia, chronic fatigue. So it gets muddled and it gets tricky. And I think that's a big part of why it's so hard to diagnose. The bigger symptoms tend to be migratory joint pain and or swelling, brain fog, fatigue. Those are the three biggest generally that we'll see. But like I said, it's the gambit. And some people will just show up with this new onset anxiety that they never had before. And that could be their presenting symptom. So you need to find a clinician who's willing to kind of dig in and continuously unravel and try to figure out what's going on. And a lot of people never saw a tick on them. They never saw a bullseye rash. I never did on myself. And
I
so
think
it's
that's a
easy
big
to miss.
myth. That's a big myth there. People say, oh, I never had the rash. It's not Lyme. I'm curious, how often do you see that is the case? No rash, but still an issue.
We see that probably the majority of the time. I think the rash is easily missed because typically it's not painful. It doesn't itch. And, often it's, on your scalp or somewhere that it's hidden that you don't see, and it disappears. So it's only there for a week or two and then it goes away. And so it's really easy to miss it. And the typical quintessential bullseye rash is only there in the people who get a rash. Only less than half of those people get the bullseye rash. So sometimes the rash looks like other things, just a red blob or cellulitis. It's not that perfect bullseye picture. So even then you could have a rash and it may not be the perfect Lyme rash. And so it gets, thrown off as could not possibly be it.
Yeah.
Wow.
That's fascinating. And I think a lot of these myths around the diagnosis of prevent people from getting the right answers. So what other myths other than the bullseye rash, maybe kind of missing that, maybe not having clearly some brain fog, fatigue, environment? Are there parts of, I know states where there's a higher proportionate load of it, but just because you don't live there doesn't mean you can't get it, of course. Any other like big myths that we need to dispel here?
Oh gosh, there's a lot. Typically speaking, one dose of medication is not going to cut it, or even 2 weeks. In my opinion, you need to hit a full life cycle of the bacteria. The medicine that we usually use is called doxycycline. That's usually the first line when you get an acute Lyme infection. And it actually doesn't kill the bacteria. It only kind of stuns it to allow your immune system to kick in. And so we really need to get enough of that in there to allow your immune system to get in. So at least a month of treatment is necessary. The sooner you can get treated, the better. But these chronic issues do start to overlay, and it gets much, much more complicated. But it doesn't mean it can't be dealt with. It doesn't mean you can't heal. It doesn't mean it's not a life sentence. And that's, I think, for a lot of people are in the midst of it and they've been sick for so long and they keep getting told there's nothing wrong with them. Your labs are normal. Here, go see your psychiatrist. It's terrifying and scary because you think you can't get better, but you really, really can. And it's hard work. It takes a long time, but healing is there and it can happen.
Yeah.
Okay. Can we take it maybe a step back? I didn't even think about this. If people in the audience are wondering, how do we get Lyme? Is it only through a tick bite? Can you get it another way?
You can get it in other ways. Yeah, the quintessential way is a tick bite. And, every state has ticks. And Lyme disease has been found in every single state and virtually every country in the world. There are, as you mentioned, more states that are more prevalent. The East Coast, Wisconsin, Michigan, those are big areas as well, but they are everywhere. And so that's the biggest way. And again, some of these ticks and like the baby nymphs can also share Lyme disease with you. And those are so tiny. They're about the size of a period on the piece of paper, a printed piece of paper. How are you going to see that? It's so easy to miss these things, right? So there's some postulation, there's studies and research, and not enough, but there's some research about other vectors. So we say vector-borne disease, that means biting insects, essentially. So it's possible maybe that there are some others, but Lyme, typically right now what we're finding is on ticks. There is also congenital Lyme as well, meaning mommy can pass it on to baby. There's a big lack of research in that area, especially around chronic Lyme. So most of the research that's out there is with acute Lyme. So mom is pregnant, mom gets a bullseye rash, that's when it's studied. Other vector-borne illnesses can get spread this way as well, but there's just not enough information. We need to learn a lot more about what those risks are. And then the jury is out on sexual transmission. That has not been proven one way or the other. I will say Lyme's dumb cousin, as I like to call it, syphilis, is a sexually transmitted infection. They're both spirochetes, so they're corkscrew-shaped bacteria. And that one, syphilis is obviously transmitted via sexual transmission, but we have not confirmed that with Lyme disease. And I will say there is something magical, might be the wrong word, but there's something special about the tick bite. So the spit and the saliva from the tick actually helps to make Lyme more infectious. So there is something about that tick bite that makes that a more potent transmission possibility.
Okay. So direct. So then the vector-borne potentially is even worse than the congenital being passed. You can have it. And I guess if your load is high enough, like we really believe in a bucket theory, and perhaps that's why some people can walk around with Lyme and not really think twice about it, right? So potentially a lot of us, maybe more than the people that think they have Lyme, really just depends on what else is going on, co-infections. I would love to get into nervous system with you, but what are some of these other things that increase the load or the burden of a Lyme infection?
Yeah, that's a great question. I think that's part of another reason why it's so difficult to diagnose Lyme, because it's different on every terrain and it presents in different ways on different people. And, you know, when you start to add life experiences and genetics and other things on top of it, you know, Lyme in patient A versus Lyme in patient B can look completely different. So it's
Totally.
really hard to kind of streamline it and say, you know, it presents like this, and then this, and then this, and then this, because it just doesn't. It's so complicated. And the Lyme spirochete is incredibly intelligent. It's beautiful and terrifying if you look into it, but it actively changes your immune system. So your immune system will ignore it. It likes to hide out inside the cells. It will form these round or cystic bodies and kind of hang out, but it will actively change your immune system. So your immune system starts to attack outside of the cells and to attack self. So it can really kind of direct that autoimmunity. That's one of the reasons why Lyme is such a big driver for autoimmune disease. And why it gets so different and complicated and complex. It's so complicated and complex. I think I lost my train of thought. Where do we start with this question?
Yeah, just the bucket. Like everyone's load is different.
The
So
bucket,
depending
yeah.
on what else you have going on, you may really be predisposed to an autoimmune condition much faster than someone else that doesn't have a lot of stress or, you know, lifestyle is dialed in, right?
Yes. Yes. Yeah.
Yeah.
Thank you. And I wanted to point on too, you said there's probably more people walking around. Something about half a million people are diagnosed with Lyme every year in the United States. And I really think there's a lot of people walking around with these things who don't know. They don't know. They think that they, you know, are getting older, or they're just stressed, or, you know, they chalk it up to other things, and slowly, progressively over time, these infections start to really eat at us. But the people who are exercising and trying to eat as well as possible and manage their stress and get good sleep are going to tolerate these infections so much better and can probably be fine with them. You know, we haven't done a massive study where we've tested, you know, healthy people to know what they have either, but I think they're probably more prevalent than we know. Yeah.
Yeah.
It'll be very interesting. I want to be a part of that study if someone does it.
Yeah, I don't know who's going to fund that, but it'd be nice. So I'm glad you brought up testing. So I actually had a personal experience going through Lyme testing with my battle with chronic fatigue. I had several more holistic alternative practitioners say, no, it's not Lyme. It's not Lyme. Don't bother testing. Finally found one practitioner that was like, you haven't been tested for Lyme? You should totally test. We test. It's negative. She writes it off. Another practitioner looks at that test and says, oh, that test is useless, doesn't tell us anything. So I'm like, and these are all alternative practitioners, and I'm very confused by that. So I would love to hear what you've learned in the realm of testing, what you recommend for patients.
Yeah, testing, unfortunately, is not as great as we need it to be. It's very gray still. It's not very black and white. And there are some better tests out there. There's actually a lot of funding right now going to research for more and better testing, which is awesome and wonderful. It will help make everyone's job easier if we can actually kind of pinpoint what's going on. One of the biggest tests that we have right now that we rely on is called the Western blot. And the Western blot is actually looking at your antibody reactions to the bacteria. So it's not looking at the bacteria directly, it's looking at your immune system. So that is where it kind of gets complicated, because one, you have to have a strong enough immune system to make antibodies. Otherwise, it could look falsely negative. Two, you know, those antibodies don't necessarily mean active or inactive, new or old. So it makes it kind of difficult to look at that. The Western blot, the CDC kind of has their own criteria for what is positive and what's not. And really, if you look into their literature and their statements on that, it's really just to put a pin on a map. So it's for surveillance purposes. It's not actually for diagnostic purposes. But instead, we tend to use them for diagnostic purposes, which is not fair. You have to have so many different bands positive in order to be considered a positive Lyme case. We look at IgM antibodies, we look at IgG antibodies, and Lyme doesn't read the textbooks. It does whatever it wants. And those IgM antibodies can stay positive much longer than a typical other infection might. And it does, like Lyme will actually change the immune system, so it can't change from IgM to IgG where it's supposed to go, just to complicate things even further. So if you don't know the test that you're ordering, it's really easy to say, oh, it's negative, because the CDC says it's negative, or it only has this band, or what have you. So you have to really understand the test to be able to interpret it, to be able to help the patients. And then I couple that with the history, with the physical exam, with the other labs that I'm looking at in the immune system, and put it all together, and then come up with my thoughts. Is this Lyme or not, or co-infection or not? Like, what may be going on in there? So we struggle with that, and it's a complicated test. It's not perfect. So, hopefully over time, and there's, like I said, they are doing some research and trying to look into these, and there are some other out-of-pocket tests to look at other aspects, and to look for the bacteria or parasites themselves as well. So there is some better stuff out there, but if you're only looking at the Western blot and you're only getting the version that like Quest or LabCorp is doing, you're not getting the full picture of what's there, and so you really have to have it interpreted properly. Yeah.
Mm-hmm. Got it.
How helpful are the CD8, CD57? Is that the right number? How helpful are those antibodies, like high or low?
Yeah. So that's actually a natural killer cell. So it's a different kind, a different part of your immune system that the CD57 looking at. It's actually looking at the cellular differentiator number 57. So it's a very particular natural killer cell. It's not diagnostic of Lyme or anything, really. It's just looking at one aspect of your front line of defense, white blood cells that kind of fight off anything. And it is correlated with Lyme. People with chronic Lyme tend to have a lower CD57. Babesia, other infections can mess with that as well. So it's not diagnostic, but it does help us clinically to look at that. And it gives me a gauge too, usually, of how well this person might react to medications or herbs, or how long it's going to take them to get better. It can kind of give me some of that insight clinically in the background.
That's cool. Okay. So it kind of nuances the whole picture. I'm really excited to get into protocols with you, but I am curious, is there any way to like provoke Lyme because it's so sneaky and hides, or is that too aggressive and would produce too many symptoms? Is that kind of on the horizon for testing?
You can, and there are some providers who do. They will put people on antibiotics first before they test. Not sure that's ever been scientifically proven one way or another, but there are people clinically who use that. Another thing that I will do sometimes, especially when I'm looking for those, like it's an RNA probe lab that I use to look for the genetic material of the bacteria or parasite, depending on what I'm looking for. I will often use enzymes to help eat up the biofilm and kind of break that up a little bit, so that I have more available to show up on the test, which there actually is a study in dogs for Babesia and enzymes before and after. So there's some research showing that methodology is useful and helpful to do that. But that's, that's another way to kind of test for Lyme, actually, is that if you give someone antibiotics and they feel worse, called a Herxheimer reaction. It's a die-off reaction. It's a immune reaction to all of those extra toxins that you just kind of put out into the system. That can be a clinical sign of Lyme disease if you treat someone, if you put them on antibiotics and they feel worse before they feel better. Yeah, it's one of the not fun parts of treatment.
Yeah, and I imagine as a practitioner, a hard part to relay to your patient, like you're gonna not feel good, but part of the healing journey, right?
Yeah. It's hard. It is a big discussion. I try to set patients up for success. If this happens, it's a good thing. It means we're getting somewhere. Here are the things you can do to help manage that. And we'll stop if it gets too bad.
Sure.
Yeah.
Okay. Yeah. How do you decide like how much pain the patient should kind of push through with a Herx? It's like, I feel like that's a delicate balance. And maybe what would you recommend? Charcoal, sauna, coffee enemas? Like, is there anything we can do to offset those?
Yeah, all of the above, actually. I usually leave it in the patient's hand. I tell the patients, you're going to know the difference between this is yucky and I can manage it, I'm going to get through it, and no, absolutely not. I can't get out of bed. This is not going to work. In my opinion, that's too much. That creates too much of an inflammatory response that creates more work to clean up. So I want to push it, but not so much. And so if we can't tolerate it, we have to go a different route and try a different treatment. Detox is huge for it, helping support detox, and anything to help lower inflammation also will help with that too, just to calm that cytokine storm, that inflammatory response that happens will help to mitigate it. And if you do something like charcoal or an Epsom salt bath and those symptoms go from an 8 to a 6 or a 4, okay, this is a herx. This is what I was warned about. Okay, I can do this. That gives us more, it gives you more empowerment that that we're on the right track.
Yeah, that's the word I was
for
thinking
sure.
of. Very empowered if they can track their symptoms as a gauge of where we are on the spectrum. That's really cool.
Yeah.
Yeah.
You just mentioned cytokine storm. I'm curious, have you seen any connections with, well, COVID, obviously a big one recently, but also like Epstein-Barr virus or any other viruses? Is there a connection there?
Huge. Yeah, I've had one patient with long hauler who did not have chronic tick-borne infections on testing. So virtually everybody has already had Lyme they didn't know about, and COVID kind of woke it up, if you will, and added that all to the mix. But I think there's one of the like silver linings to COVID is that it's really opened up in the general population knowledge base that infections can cause long-term issues. So this acute issue can cause a chronic issue because it really alters the immune system. And Epstein-Barr is a big one that has done that, that we know of as well. But it allows these tick-borne infections to get new life in the way that we can start to research them again and look at them differently to get that. Lyme doctors have known this for years, right? We know that that's big part of what we're battling is the immune implications, not just the infectious disease implications of it. So balancing and juggling all of that. So a lot of the treatments and things we do for long hauler COVID are one and the same for this long hauler or long Lyme issues, because it's all about healing and repairing that immune system, calming that immune reaction, retraining the immune system to stop overreacting, that process to it, not just about fighting the infection, killing the bugs.
Got it.
In terms of inflammatory load, when we're looking at terrain theory, is it your opinion that we should be able to coexist with Lyme? Like if we're able to really train our immune system, lower inflammation, get a healthy, balanced lifestyle, should we be able to coexist, or across the board is Lyme a bad thing that we do not want in our body?
Yeah, Lyme is a bad thing we do not want in our body. It's definitely been implicated in things like Alzheimer's plaques, and some of these co-infections are associated as well with cancers and other things. We do not want them. However, I think trying to eradicate every single last spirochete from your body is also in ways futile and can cause more stress because it's this endless, drive and pressure and burden to get this out of your system. Meanwhile, we've got things like chicken pox. I don't know about you ladies, but I had chicken pox. No one gets chicken pox anymore. But once you get chicken pox, you always have chicken pox. Yeah. And it never goes. It's always in my system. And I might get shingles, like that's the, a reawakening of the chicken pox. But 99.9% of my time, like it's not awake. It's just in there and we're hanging out, So for me, part of my exploration, my own personal journey is, in a way, kind of having a conversation with the Lyme and the Bart and the BBC and say, hey guys, I don't want you here. If you're going to be here, you got to be here for the greater good. And I know that sounds kind of wild to say and kind of talk to as a medical doctor, but that perspective and changing that attitude means I'm no longer constantly at odds with trying to like flush out and completely clear out my system. I'm more in a balance. And so those kind of shifts really made huge impacts for me. And if we can kind of help my patients help that repair and that retraining and that reconversation, it really does seem to help people get better faster and to stay better longer. So it's a little, it's two-sided to answer your questions. Yes, to all of the above, but we want to try to get as much as humanly possible out of our system, and we want to get ourselves healthy. And then we need to focus on being healthy and not on the labs or focusing on perfection.
Yeah.
So it's about healing. It's about repair, and about love and grace and all of that, right? Yeah.
Yeah.
Yeah. I feel like what you're
Coexisting.
ultimately saying is teaching the body that it can naturally heal if we give it the right cofactors and the right environment, right? It's not, yeah, I understand that conversation about like, we got to kill this thing that's bad in my body. It's just such a negative feedback loop.
Yeah. Yeah.
Not helpful.
Yeah. This is, I don't know, kind of a funny thought that's coming to my mind. There's a comedian, Jim Brewer. I don't know if you're familiar with him, but he does this skit called Party in My Stomach.
This is my favorite. I love it.
Granted, it's my favorite stand-up of all time. Granted, it's about alcohol, but he talks about like, okay, if you're going to have the Heineken and then the tequila come in, you're going to talk to them. Hey guys, you're going to get along, and then whoever shows up, all right, you're going to have a party in my stomach. We're all going to get along. Otherwise everybody's out. So I'm kind of thinking of like, this is like all the Lyme and the Epstein Barr. It's like, all right, if you are going to stay, we're going to keep it quiet. We're going to all get along together. We're going to support each other. We're going to have a party. We're going to keep it a party vibe. Right? Not a war,
Yeah.
not an internal
Not a
war.
war. Not a war.
Such a great analogy. And I love that one because is it tequila that comes last and ruins the whole party? Because there's just like tequila shots at the end. It's like, okay, now the bucket is full. Now the system can't handle any of it. Get out.
Everybody out. Everybody out. Yeah.
Yeah.
So, okay. There's a little humor. Everyone going, if you haven't seen that skit, go to YouTube and search Jim Brewer Party in My Stomach. It's a good laugh. Okay, so circling back,
Redirect.
so you had mentioned something about retraining the immune system. How do we do that? Because I feel like there's a lot of misinformation about like, oh, this boosts your immune system or this dampens your immune system, but really we won't want to be kind of empowering our immune system to be working optimally. So what strategies can we incorporate for that?
Yeah, I think modulating or balancing the immune system is better. The immune system is so it's complex and it's smarter than I will ever be. So I want to try to get, into the hands of the immune system and say, you figure it out, because sometimes you do need more and sometimes you need less. And like the immune system needs to be able to figure out that balance, because too much of a good thing can be a bad thing. And so far be it from me to keep pushing, one supplement or one medication to drive when we need to actually be rebalancing and helping to kind of keep that in there. So one of the ways that we talk about doing that in our clinic is through limbic system repair, because the brain and the nervous system is so important for the immune system. They are intertwined, and there's been tons of research in this neuroimmune, endocrine, psychiatric combo. Like everything is, lo and behold, the body is connected.
Yeah.
What? We're all connected. It's weird, right? I know. Wild. So, and a lot of it is the brain starts to think, oh my gosh, there's inflammation here. There's this, I have to respond this way. Aren't you proud of me? I have sent out inflammation because someone looked at me the wrong way, right? And so it gets trained into that light. And these chronic infections are triggering PTSD loops exactly like, traumas with a capital T do. It's all in there, kind of forcing this inflammation, and the brain thinks it's helping. And so we have to retrain that brain to say, I love you, brain. I appreciate you. I appreciate that you're there and trying to support me, but can we maybe try to react this way instead? And there's loads of research and data out there. A lot of it's with pain, chronic pain, and retraining your brain to accept that and work through that and process that. And it really can lower pain levels as you retrain this. And I always need to say too, this is not being made up. People are not making this up. This is not all in your head. This is real physiological reactions to a bacteria or a stress or whatever's in the system. And so doing some of that vagus nerve, limbic system repair, there's programs, there's apps, there's wearables, there's all kinds of things that help with this process, and trying to get out of that fight or flight, because we just stay in that fight or flight, and we also get frozen with these chronic infections as well. So trying to work through that process can help get that immune system better, so it can modulate, so it can balance for us and figure it all out. That's also hard work.
That's great.
It takes a lot of work to get to that spot, but it really can make a difference.
Do you have any favorite devices or apps for this, like vagus nerve stimulators, anything like that?
Yeah, there's a lot of them. I like the Apollo Neuro bracelet. I think that's a good foray. My patients are super sensitive, so I usually start with 5-10 minutes a day. Don't just leave it on. for hours on end initially because it can overdo it.
Mm.
We also do microcurrent neurofeedback in our office. So that is using tiny electrical pulses to help reset the brain and hear your brain's brain waves and send feedback to help retrain it and calm
Is
it
that
down.
the ISS technology by any
We use
chance?
Lens. Yeah.
Oh,
Similar. We
okay.
use
Okay,
Lens, which
similar.
is a little more updated. Yeah.
Yeah, cool.
Um,
It's amazing
uh,
technology.
it is. It's really fascinating and it works. And it works quickly too. Usually
Yeah.
within a couple sessions, people are feeling calmer, sleeping better, and it starts to really build. And you don't have to do anything, you just sit there.
Right.
You know, it's a very,
Oh,
very
nice.
passive way to foray into it. What else? I like the program by Primal Trust, primaltrust.org.
I keep hearing about that lately.
Yeah.
What does that program consist of? It's all at home, right?
Yeah, it's an at-home, it's an online community. There are different modules that you walk yourself through at your pace. And it starts off very, very, 5 minutes a day, very small, and you build upon it. Especially for those who are really sick, they have to go slow. You can't overdo it. You have to go at your pace. But in my opinion, that program helps to really bring in different aspects of neurolimbic repair. So some eye exercises, somatic exercises, retraining the brain, like dynamic neural retraining type of work. And you can slowly add and build. And by about module 7 is when you start to dig into trauma. So you've built up this big foundation before you get to the heavy stuff. But they walk you through it. There's a big community there. There are other programs out there like this. And so really it just depends on what's best for you and what works for you. But that just happens to be one of my favorites.
It sounds like DNRS. Are you familiar with that one? Or maybe
Yeah,
that's
it's she adds that in. So that's that dynamic neural retraining. That's a part of it. She does talk and work through that an aspect of it, but she adds, and the Primal Trust adds more to it. It's more beef to it, more meat to it.
I love that it's accessible. Like anyone can do it at home. I mean, it's on a computer or device, but you don't have to buy some fancy piece of tech or go somewhere, right?
Yeah, exactly. Yeah.
Yeah. It's so
Lots of great
interesting to me. I
options.
mean, you said a few times, like the body is more complex than we could ever understand. The immune system, the brain. It's strange to me that the nervous system would so easily flip to sympathetic and not know how to get out of it, which tells me that it's there for a reason. It's trying to protect us. So what do you think is sort of like the evolutionary reason behind the body getting stuck there? Because for ultimate healing, we want to come back into parasympathetic or be in the middle. Why do you think the
Yeah.
body is keeping us stuck there?
I think part of that has to just do with how our culture is these days. It was designed to set us up, lion is chasing you, lion is gone. That's how it still works, with zebras. Their cortisol will go up when that lion is there, and then the lion's gone and they come down. But in our lives, we don't ever come down. There's too much background stress. There's too much going on. Your mind's always going with other things. So the lion is chasing us 24/7. So we're not teaching our system, we're not allowing our system anymore to relax. And in our culture, relaxing is, often frowned upon and looked down upon, and you look lazy or this, that, and the other. So when we live up there all the time, and then you get a chronic infection, it can't stop. And so it's just this perpetual motion machine that you have to retrain, you have to teach to relax. And it can require some work to really, really learn how to actually relax.
Yeah. So it's the lifestyle that sets the stage. It's the infection that really like seals the deal. So that's why we need to pull in this retraining. We can't, at that point, it's like breathing exercises are probably not going to cut it. Right.
Yeah. It's going to help. It's a part of it. Right. But you're not actually going to like relax enough to get those parasympathetics in there, kind of chill out.
Yeah. Do you ever use HRV biofeedback?
Not in the office, but there are great devices like HeartMath and things out there to help reset and work. It's just another good bio device to help calm that for sure.
Yeah, that's great. One more tech question while I'm on the roll. What about amp coil? Have you used that? Do you have any thoughts about that with Lyme?
I have not used it. I've seen I've seen it at different conferences here and there. I know, I'm assuming, correct me if I'm wrong, that it's like a frequency specific microcurrent type of
Yeah,
deal.
it's a
Yeah.
coil Tesla technology
Okay.
with a magnetic sound vibration, like acoustic therapy. It's an amplifier that
Okay.
delivers frequencies.
See,
And it was
okay.
designed by a family that all had Lyme. So
Yeah.
actually it was designed for Lyme, but now it supports
Right.
everything in the physiology,
Nice.
viruses,
Yeah.
bacteria, nervous system,
Yeah.
sleep.
Yeah, it's really interesting. You know, the frequency specific microcurrent therapy is really kind of burgeoned over the last several years. And, you know, they're using it now at big hospitals like Lurie's and the Shirley Ryan Ability Lab, which is a big Northwestern, I believe, associated rehab institute here in Chicago. So they're starting to use this more and more and more for pain and other things again. That's kind of where the, like, you know, that limbic system training I said, it started back with pain,
Yeah.
right?
Mhm.
Yeah.
And so that's just kind of, I think that's kind of the entryway into a lot of this, because when we see, you know, that data and that research, then we can start to use it for other things. And, you know, I have seen people herx on these kind of things. I've seen people have die-off type of reactions and big flares of their symptoms with it. So it's not completely benign. I think it needs to be done in the right hands to make sure that it's done in the right way so that you get the benefits from it. But I see a lot of potential with those things for absolutely. Yeah.
Oh, okay.
Yeah, I'm a huge fan of the amp coil. I have never been diagnosed with Lyme. I don't think I have it, but just as like a product and technology, it's the best money I've ever spent. Really, just so many applications. But yes, advised to work with a practitioner. And there are settings on the amp coil, gentle, depending on age, because yeah, we don't want to make someone feel like crap. It's not always helpful.
Yeah.
Yeah. I'm curious. You have a question, Nay?
Oh, go ahead. Go ahead. I'll
I
save
was
my
going to ask
question.
about protocols. I know, of course, everyone is bio-individual. It's going to look different in everyone, but do you sort of have a basic blueprint like antibiotics, antimicrobials, biofilm disruptors, homeopathics? Is there sort of like you want to pull from a couple different buckets? Or maybe we can just start with, do you even use antimicrobials? Is it always antibiotics?
We use antibiotic prescriptions or antibiotic herbs. We use intravenous therapies to support things as well. So we kind of pull from the bucket. You know, I bring the patient in as part of the team. So I'm going to ask them too, because some people really have strong preferences. They do not want prescriptions or they only want prescriptions, right? And that matters. Like that is going to play a role in how they respond to things. So those questions are there, you know, and I ask people where they are and things. And if one route where we went down one route and it's not working, we can always shift and go down another route. And sometimes the people who really wanted antibiotics actually needed the herbs, you know, so we kind of go there. But I don't have, unfortunately, I can't give you like a set protocol. I do have some go-to combinations that I'll use for, you know, this infection versus that one. But it's very, very patient dependent and grabbing from those different boxes to figure out what their symptoms are, what's going on, what I need to tackle first. But antimicrobials are generally used at some point. We don't always start there because sometimes we really have to heal the gut first or get their detox pathways first, you know, that kind of thing. But detox is important. Everybody's getting some sort of detox work one way or another. Usually mold or other things are added to the mix as well. And as I mentioned earlier, it also helps with Herxheimer and die-off reactions. So everyone's getting some detox support, some gut support, neurolimbic support. You know, we're trying to juggle all these things and keep all the plates spinning. If it were just 2 weeks of antibiotics and we were done, it sure would make my life a lot easier, but it'd also be more boring. So
yeah. What would you do with all your spare time?
Right. So
yeah,
but we've used it
so
all, you know, and
nuanced.
it's very nuanced, and I've seen people heal from things that I didn't even necessarily expect them to heal from, if you will. Just, you know, sometimes all it takes is really, really digging into that past trauma, and then like everything gets better and calms down and everything comes to a place. So, you know, and sometimes it's just this little tweak that we needed to do over here. It's, you know, it comes in wild places, but we're curious, you know, that's big thing here at my practice is why what's going on? Why is this working? Why is it not? And we are always adjusting and trying to figure it out because we have to meet that particular patient and all of their history and what's going on for them. And it's complicated. But it's beautiful too, because we get to see some really, really, really cool changes for people's lives.
I bet you have some amazing testimonials from people just flipping their lives upside down in the right way,
In the right way, yeah.
Yeah.
We actually call them disco balls. We have a disco ball and we literally drop a disco ball and have a little party when people get their lives back. And it's not that we're necessarily done with treatment, but when someone, couldn't read a book and they love reading books, they now can read a book. That's a disco ball moment. This is huge. Like, we need to celebrate these wins and victories. So yeah, we take pictures, we have a little celebration. It's, it's important for us and the providers and the team to know and see that as well. That we, change can happen. People are getting better, and it's really cool to be a part of that.
Mm-hmm.
Oh, disco ball moment. Oh my gosh, that's so great. I mean, and I'm sure that just keeps you and the staff going every day, just to have that drive.
Oh, yeah.
I love that. So it sounds like with the supplements, again, it is very personalized. It's going to be dependent on the person. What about diet? Is diet kind of the same for everyone, or is that pretty personalized too?
There are some kind of general guidelines. Typically gluten, dairy, and sugar are the three that are going to really suppress the immune system the most. So those are definitely things that we try to reduce, if not eliminate. I have a couple people who just really thrive on the carnivore diet. We have people who do intermittent fasting or, more of the ketogenic diet. We have low FODMAPs diets. We use a lot of different food as medicine. But I also, again, this is another spot too, where when I'm throwing 1,000 things at someone, here's your antibiotic, here's your probiotic, here's your detox, here's, and it's like, and you have to cut out 16 different of your favorite foods. We start and we build, and we really try to work and making improvements. You cannot get better if you're eating McDonald's and drinking Coke and smoking cigarettes. You're not gonna get better. Food is very, very important. Yeah.
Yeah.
Yeah. But also like such a
too.
personal opt-in, you can't make people do all the things at once. I have a client, she's like ready to eat everything organic, grass-fed. And in the middle of our session, she started smoking a cigarette. I was like, this is a first. I had never seen anything like that.
This is virtual, clearly, but still.
Oh yeah, virtual. But I was like, man, like, we really have to meet people where they're at. People are only willing to make certain changes in a given amount of time. So, as providers, we can educate. Obviously, people know smoking is bad. So it's like,
yeah, there's no debate on that anymore. The debate's done that smoking is bad. I'm so amazed how many young people I see smoking.
Yeah. Yeah.
Out and about.
Shocking.
Yeah. Or vaping.
Oh,
it's the new smoking. Yeah.
Yeah. Terrible.
Terrible.
What other, I'm curious about lifestyle, but I'm actually even more curious about other potential, like big toxicity issues, like dental work, amalgams, cavitations. You mentioned mold already. Any other viral infections, parasitic infections, anything else you see compounding more frequently than not?
It's interesting too. You're talking about your dad and stuff too. Spirochetes, those corkscrew bacteria love the mouth. So, and there's some of them are not necessarily pathogenic, but it's an interesting way to kind of test as well, especially because if people are getting caries and just having all these mouth issues, it's worth testing the mouth for different infections and seeing what's happening in the mouth and trying to treat that. I have had people get, their root canal, the tooth removed, cleaned out, implant, and then their symptoms go away. It's another one of those, wow, sometimes you just have to look at, at these other places, these pockets of inflammation and infection as it can drive. Some other confounders, mold is a big one, or just other toxins. Some people are just highly toxic. Mold just seems to be a big one because it's pretty prevalent around and not very well understood in there. And there's a huge genetic component to that as well. But if you have Lyme and all these other things, you can only detox so much. And if you can't get it out, you might have other people in your house that are perfectly fine and can handle it, but you can't. And so that really messes with people because their husband or their son or whomever is totally fine. And so they look at the patient like they're crazy because they feel unwell in that space. And it just creates, even more stress, unfortunately. But mycotoxins are a big part of it. And what's the chicken and what's the egg?
Yeah.
It's hard to say, but certainly mold hits and, big mold exposures can kind of bring on all of these Lyme symptoms. Parasites, you mentioned briefly too, that's another kind of interesting one. It's really hard to test for in humans. But chronic parasitic infections can just sometimes be this big hurdle as to why we're not getting better. Is because there's still this other infection that's taking all the immune system's attention in there. Viruses can be. Typically, I will see viruses more as, I describe it as immune system whack-a-mole. So, when your body's trying to deal with Lyme or mold over here, the viruses go, whoa, no one's paying attention to me.
Yeah.
And they raise up, right? But I do have patients who are I just call them virally, and it's not very medically in tune to say that, but they'll present more virally. So there are people who, just kind of have chronic sore throat, swollen lymph nodes, like they're always coming down with a cold, but not quite. There's a couple other things, but so that may be their driver or they're winning. Maybe that one in the whack-a-mole has kind of now taken over. And a lot of this, unfortunately, is clinical. You just have to take a good history and get some intuition and try some different things. And sometimes you just have to clinically try a treatment. Let's clinically try this together and see what happens. Good or bad, let me know. That will help me figure out what the next steps are, because the testing for it is not black and white either.
Yeah. Do you even bother testing for parasites, or you just go ahead and treat it, assuming that's the problem?
Yeah, we do sometimes. There are some stool studies that are a little better than others. Parasitetesting.com has a stool study that's not very expensive compared to others, and does a pretty good job of picking up on parasites compared to others. The blood testing, things like Babesia is a parasite, which is a co-infection with Lyme, but even that it's hard to find, even though it lives in the blood. So doing a blood draw can still miss it. So yeah, sometimes you just have to, it's like, okay, here's your constellation of symptoms that make me think it may be parasites, whether it's GI or otherwise. Sometimes people will get worse around the full moon. It's this kind of cyclical pattern that they're always having. It overlaps with everything else: brain fog, fatigue, pain, joint, gut stuff, all these other things. But we try an anti-parasitic medication or herb or something, and lo and behold, everything is better or everything is way worse. That gives us, information. So we kind of dive in, and it just depends. It's a conversation that we have the patient, right? And get informed clinical consent and decide together what to do.
Right.
So complex. I mean, it really requires a lot of hand-holding, and it's a journey together, right? You can't just go online and buy a protocol. It's not going to work that way.
Yeah.
What would you say if we're going to have a real moment timeline of healing on the antibiotics or antimicrobials and all the other kind of protocols that we're trying, weaving in? A year minimum?
A minimum. Yeah. And it really depends on how long you've been sick and what other confounding factors that you have. These are chronic stealth infections, so akin to tuberculosis, which I wish we had these places where we could go convalesce for a year by the seaside like we used to with tuberculosis for these, but they're slow and they're smoldering and they hide. And so it's not just 2 weeks, it's not just a month, it takes a long time to really get to where you need to go. So you're often on treatment for 6, 9, 12 months at least along the way. But that's awful and annoying. But if you're feeling better along the way and you haven't felt good in 5, 10, 20 years, you're on board. You're like, yep, that makes sense. And that's where I want to see. It's this up and down, but overall, we're doing better. We're on the right track. And then when we plateau, where do we go from there? And what are the next steps? And what else do we have to look for? What are these hurdles? What are these roadblocks? What are we missing that we're not getting where we want to go in that? But it's a while. It takes a long time. Yeah.
Patience and hope.
Worth putting in the work. I mean, for people that have been sick for 20, 30 years. It's like a 1-year healing journey is actually not a big deal in the big picture.
Right,
That way.
exactly. Yeah.
Maybe we should have asked this before, but are you taking new patients?
Yes, yeah, we take new
Okay.
patients. Our waiting list is a little long, but I have 2 PAs that work with me. And we have
Okay.
2 other physicians at the office as well.
Okay.
My practice with the PAs are the mainstay, but we are booked out. But that I'd say, and they stay on the list, stay on there. Other people will go see other providers in the meantime, which is wonderful and great because you got to be doing something. But it's worth it to come in and have someone like listen to you and hear you and work through this and join this journey with you and be on the marathon together.
Yeah. And you do this virtually?
We do, yeah, we
virtual?
do it online and virtual, yeah. But typically, like, we need to establish care in Illinois. That's where we are. But we can do televisits in between.
Okay, wonderful. All right,
Great.
Dr. Kelley, this was a fabulous conversation. Thank you so much for sharing this fascinating, complex, super important topic with our audience. One final question for you. Can you tell our audience what would be your one piece of advice, something they can start right away today to optimize their health? Doesn't have to be Lyme related. It can be anything you want.
Yeah. Drink more water. Seems like a simple next fix. And our kids this day all have their water bottles, right? So we're doing a good amount of that. But even just waking up in the morning and instead of having a cup of coffee right away, wake up and have a cup of water and rehydrate yourself. It's a very simple, easy tool, but it can set you up for success for your day.
So good. So good. I know. So simple, but not enough people do it.
Oh, it feels so good in the morning to just chug down a whole glass of water. I'm like, it feels so good to rehydrate after sleeping all night.
Yeah, exactly.
Yeah. I don't, it's hard for me to understand how people don't want that because I crave it, like you said, Renee.
Yeah.
But
just takes time, maybe.
For anyone that's listening, it's not.
All right.
It's an easy fix.
It is an easy fix.
Yeah.
Just keep it by your bedside. So, Dr. Kelley, can you tell our audience where they can find more of you?
Absolutely. Yes. Yeah. Caseintegrativehealth.com is the name of our practice. We're in Chicago. We're on Instagram and Facebook as well. And you can find my Dr. Kelley on Instagram as well. But yeah, I mean, we're out there. We're doing our best to help as many people as we can with these chronic complex illnesses, whether it's Lyme or not. We're going to dig in and figure it out.
Amazing. Well, we'll link to all that in the show notes so people can follow you and learn more. This has been awesome. Thank you. Thank you so much.
Thank you, guys. Thanks for having me and spreading the word.
Yeah. And thanks to everyone for tuning in. We will see you next time.